Good afternoon. My name is Eamon Chihada, and I'm a third-year medical student at Western Michigan Homer Stryker School of Medicine. Our project evaluates the educational effectiveness of a neuroscience-based outreach program designed for middle school students, with the goal of laying out a framework that can be used to assess other outreach events. Educational outreach programs often share a similar goal of engaging the non-science community in a particular subject matter being presented. Outreach events can also be a strong tool to address issues such as increasing the population of students or professionals that may identify or be parts of groups that are typically underrepresented in science or medicine. In addition to this, it is a useful practice for scientists, or in this case medical students, to present and communicate scientific materials at a level that is appropriate for their audience. One of the most common drawbacks of these outreach events is that they often fail to evaluate their own effectiveness. Given the nature of these events, it is difficult to quantify the overall impact these outreach events may have. This makes it difficult to measure improvements as the program advances, as well as recognizing areas that may need revision. Overall, our goal in conducting this study was to assess the educational effectiveness of Brain Explorers, a neuroscience-based outreach program for middle school students, with the goal of providing a lesson plan that is both accessible and assessable. The Brain Explorers program was developed to provide neuroscience experiences for the local K-12 schools in Kalamazoo County, particularly for populations that are underserved or underrepresented in science. The mission of this program is to encourage student interest in topics such as neuroscience or healthcare, as well as improve their overall attitudes towards science. This program also serves as an opportunity that allows medical students to practice their scientific communication skills, a vital skill for physicians, with the intended goal of addressing particular health disparities related to health literacy. To start things off, we created a lesson plan using learning objectives from the next generation science standards. The first part of the lesson plan included a traditional slideshow presentation which introduced students to brain lobes and their functions. This was followed by 3 hands-on learning activities. The first activity was a learning and memory event where students were asked to memorize a list of words with and without the use of active learning techniques. The purpose of this activity was to reinforce the concept that memories are formed by multiple neural pathways that can be strengthened and modified, as well as provide students with a skill set that they can use in their personal studies outside of this event. The second activity was a lesson on sensory processing. Students were asked to identify a beverage that was masked with food coloring based on only sight or taste. The purpose of this activity was to demonstrate to students how our sensory receptors gather and synthesize information for memories and immediate action. For the third activity, a sheep brain was used to teach the students the anatomical location of the various brain lobes. The instructor used pins to simulate lesions on the brain and prompted the students to explain what functional deficits would be affected based on the location of the brain lesion. The purpose of this activity was to reiterate the functions of the brain lobes, as well as strengthen the students' understanding of the central nervous system. To assess the level of learning, students were asked 2 field response questions before and 2 weeks after the session. One question was covered in the content presented in the lesson and actively reinforced, while the other question was not a focus of the lesson and used as a control for our study. Investigators were blinded and given guidelines to rate each response. These ratings were then averaged and statistically analyzed. Here we can see the results of our study. Of the 71 students that took the pre-event quiz, 58 of them completed the post-event quiz. The topic of the content question, memories, was heavily emphasized in our lesson plan and saw significant improvements, with an initial score of 1.21 and a final score of 2.03. Whereas for our control question, the topic was withdrawal reflexes. This was not directly discussed or introduced during our session, and the question saw no improvement in student scores. Overall, the results of the study demonstrate that participating students achieved learning advances from the session, even 2 weeks after the visit. With that, the results also demonstrate the educational effectiveness of our outreach program. The work presented here lays out a clear and effective middle school neuroscience lesson plan that can serve as an accessible model for other outreach events. This study does present with limitations, however. The small selection of questions and students seeing the same questions beforehand may have influenced their responses. In addition to this, the results are based out of one classroom, which limits our ability to generalize our findings. Future studies could explore topics such as the influence these outreach events have on student career interests, or measuring the impact that participating in an outreach event has on helping medical students improve their communication skills. Overall, this project lays the groundwork for assessing the educational impact of other outreach events. On behalf of the co-authors of this project, we'd like to thank you for taking the time to listen to this presentation. Please reach out if you have any questions about the project. Enjoy the rest of the conference and have a wonderful day.